sure that everybody is able to view the PowerPoint and that everybody can hear us. If you cannot view the PowerPoint presentation or if you cannot hear us, please type in the message on the chat icon in your control panel. On behalf of the Expectant and Parenting Youth in Foster Care Learning Collective and CSSP, we welcome you to our inaugural webinar. Today's discussion will focus on multi-generational strategies that create opportunities and reduce risk for expectant and parenting youth and their children, through which these young families can succeed and thrive. Our presentation will begin in a moment, but first, some important reminders. A few things to keep in mind before we get started. We are recording this webinar and we'll send you a link to view the recording as soon as possible. We recommend that you listen to the webinar through a landline phone. If you're experiencing audio problems, try hanging up and dial back in. Due to the number of people online, currently all attendees are in mute, listen-only mode. You can submit questions at any time using the chat feature in your control panel. We will be holding question and answer sessions and peer discussion sessions throughout the webinar, and at that time we will unmute individual participants. To signal to us that you want to ask a question, click on the hand icon in your control panel. So here you have a lovely picture of our team that is behind the Expectant and Parenting Youth in Foster Care Learning Collective. It sometimes is very helpful to put faces with the voices and the names, and so we wanted to share our team photo with you all. Here's where what we hope to accomplish today. We hope to provide an overview of our theory of change for achieving well-being outcomes for expectant and parenting youth in foster care and their children. We'll give you an opportunity to meet both of our grantees and hear more about their efforts. We would like to have a peer discussion around the implications of the Reasonable and Prudent Parenting Standard under the Preventing Sex Trafficking and Strengthening Families Act specific to expectant and parenting youth and their children. And finally, we'd also like to share and solicit feedback on our vision for this learning collective, as well as provide you with a virtual tour of our new and improved webpage. Now I would like to turn it over to Sarah Morrison, who will begin the overview of our theory of change.
Thank you very much,
Sarah,
everyone. Thank you very much for joining us this afternoon, and thank you, Lisa, for kicking this off and getting us started. And Lisa is one of those folks pictured on the team, and this is Sarah Morrison. I'm also one of the ones pictured on that one slide, and welcome. So today we're going to spend just a few minutes sharing with you the theory of change we're working with at CSSP with regards to improving outcomes for expectant and parenting youth. So we want to take a few minutes to review the elements of the approach that we've developed that's based on the strategies, building protective and promotive factors, creating opportunities, and addressing risk. And we also, most importantly, want to share with you the results that we're trying to achieve with this the young parents and their children. And that's really where we're going to start in this journey. So Lisa, you want to go ahead and show the full results slide, please? So at CSSP, we've developed over the last several years two initiatives, both informed by multidisciplinary research in the field, and this is one more step in the process that we've been working on. First, we formed our Strengthening Families work, where we've identified how parents can be supported to be parents and to succeed as parents. And secondly, in our Youth Thrive work, where we've identified how adolescents can be supported to thrive and transition into successful adulthood. And we've put it together, those two ideas together in this initiative to use the knowledge and experience to suggest a way of thinking about how we work with and support expectant and parenting youth, not just as adolescents or not just as children, but as a family. And the one thing that I should say is the term expectant is a very intentional word. We've learned over the last several years working with communities and agencies around the country that when we say pregnant and parenting, we might very well be leaving out an important part of the equation, and that is the young fathers. So we've changed our language to try and be more inclusive and to reflect the fact that we do believe in including young fathers in this process. And the sites that we're working with are very interested in young fathers. So as you see on this slide, the two primary results we'd like to see with the expectant and parenting youth is first and foremost that they're thriving as youth, that they have educational success and they have strong, stable connections, and that they're physically and mentally healthy, and they're supported to maintain that health. And by becoming thriving youth, they're better positioned to become nurturing parents. And when we think about nurturing parents, we want them to have the ability to keep their children safe, to help them be healthy, and to help them ready to learn. And so this is really our end result that we're trying to achieve. And I want to move on to the next slide to share with you, so how do we think we can achieve these results? We have several elements to our approach that we've thought about. And first and foremost, we think it's a multi-generational approach. And again, we're very intentional about that language. We can think about this as a two-generation approach. Obviously, we have a parent and a child. But when we think about the parent as being an adolescent, that adolescent still needs the support and guidance of an older mentor or family member or someone who they can stay connected to and have permanency. So too often we think that when a youth becomes pregnant and parents a child, that they've taken on an adult responsibility, and we begin to think of them as an adult and forget that they are still very much adolescents that need to have a strong, permanent connection, just like their own children need to have a strong, permanent connection with them. So we really want to see this work blossom into thinking about how do we really pull in and help the supporters of these adolescents really give them that stability and that permanency that they need just as much as their little ones do. Another piece of this approach is that it's developmentally informed. Again, the work that we've done over the last several years at CSSP has taught us how critical different developmental stages are with little ones and adolescents. And so all of the work that we're doing now is really focused on how do we make sure that what we're doing is appropriate for the developmental stages that we're working with. Trauma-informed, that's a common word used now, but we know that these young people often have suffered, have numerous trauma experiences by being in foster care, by being separated from their own parents, by the experiences of being exploited, abused, neglected. And so we need to be mindful of that, along with where they are developmentally when we approach working with them and helping them to work with their children accordingly. Multisystemic is another essential part of this approach. And by multisystemic, we mean one system cannot do it by itself. We've often said at CSSP that the child welfare agency, institution, needs to have partners to help support them in their work of helping children be safe and have permanent supports and to achieve a level of well-being that we all want for ourselves and for our own children. So when we say multisystemic, we mean that there needs to be a partnership that is working collectively on behalf and for these youth and their young children. Youth-driven is another very important part of value of our work, and that is that the youth have a voice in all of this. We need to respect their voice. We need to respect what they're thinking and the decisions that they are making, and we need to help them have that voice and be a part of all this. So we're expecting that the youth will have a role in the initiatives that we're working with, and they will be able to voice their opinions about the directions and the strategies that we're using. Results-based learning and accountability. I demonstrated that a little bit by starting out in the very beginning about what is it we want to learn, what is it we want to achieve, that we're starting with the end in mind. And that's what we're doing with this, what we're trying to encourage all the sites that work with us to really think about what is their vision, what is their results they want to achieve, and how are they going to hold themselves accountable to achieving that? What is the data they need? What is the tracking that they need to have in place? And finally, but certainly not unimportant, is that this work needs to be informed by evidence and practice. And that's evidence, again, from multiple systems and multiple sources, including neuroscience and developmental and mental health work. And so this is a summary of what's really key to our approach and what we think needs to be in place to help achieve those results that I mentioned. So Lisa, do you want to go ahead with the next one, please? We talk about building protective and promotive factors. And again, this has grown out of the work the CSSP has been doing for a number of years. Some of you may be very, very familiar with it and have seen it in different formats. But we've talked about how youth and children and parents all need to have protective factors, and many of us have them, but sometimes they need to be strengthened. And so one protective factor is resilience. As a youth, adolescents need to learn how to manage stress and function well when faced with stressors and challenges or adversities, and that is the outcome is personal growth and positive change, and that they're able to handle challenges better each time they go through adversity. And as a parent, that same youth needs help in understanding proactive ways to manage their own parenting stress. All of us who have been parents at whatever age we've been at know how stressful and trying being a parent can be, because we just don't understand our child's development sometimes, and we're scared of doing the wrong thing. And so we need to think about how do we help the youth manage that same kind of stress, recognizing that they are still at an adolescent stage in development. Social connections is another protective and promotive factor we found to be essential. And when we think about youth, we think about them building healthy and sustained relationships with people, and because we want to promote a sense of trust and belonging and a feeling that they matter. And by doing that with the youth, we help them understand that they need to sustain networks that are supportive to them as parents, and that they can seek out and provide assistance and positive norms around their parenting role. Knowledge of development. Those of us who work with youth, whether they're parenting, expecting, or parenting yet, still what we need to know is what's the understanding about what's healthy for their development and their well-being, and help them to understand their own development, and particularly young women who are going through pregnancy are experiencing a lot of physical changes and hormonal changes that really need to be respected and help them understand what they're going through. And that's just one example of helping them to understand development. And by helping them to understand their own development, we help them to understand and reflect on how their experiences in childhood influence their parenting, and how they might learn to parent differently, or how important it is for them to understand their own child's development. Concrete supports. I think we all know what those are. Those are things that we need that help us do what we need to do without worrying anything more, like a roof over our head, or a crib, or diapers on a regular basis. These are all things that help youth build skills for asking for help and navigating help to ensure that they get the supports that they need. And when we think of youth as parents, we want them to be able to have the basic services for their own children to maintain good health and development, and to support the youth in becoming effective advocates for their child's needs. And lastly, developmental competence is a protective factor of great importance. For the youth's personal development, we should be able to provide experiences that build a sense of future orientation, of planning, decision-making, conflict resolution, and communication skills. And as their parents, we need to help them, just like we might say to them, use your words, and we might say to our little ones, use your words. We're helping them learn how to express their feelings and how to develop self-regulation and to learn to interact positively with others. And so it's really helping the youth help their children. We're also helping them see their own experience and go on that. And so that's what's really important as a strategy in our work, is the building these protective and promotive factors. So Lisa, let's move on to the next one. So how are we going to know whether our work is getting us to the results we want? Well, we've established some what we call indicators for tracking achievement. Indicators that will help us know whether our youth really are thriving and whether they are really becoming nurturing parents. And I'm not going to kid anybody. Some of this data, some of these indicators are going to be very difficult to measure in the very beginning. But if we don't stretch ourselves and ask ourselves to figure out ways to begin to collect this data, then we will never have it. So we're really challenging ourselves and the sites that we're working with to think about how can we get the rate of trauma symptoms among thriving youth so that we know whether we're making a difference. How do we understand the rate of regular use of medical care? Again, that may not be easily tracked right now. We can track subsequent births pretty easily, and we can track rate of high school graduation. So there's a real mixture here of degree of difficulty in getting the data we need. Likewise, with identifying a way of measuring whether we're achieving nurturing parents, are those little ones being immunized? Are they born healthy? Those things we can get fairly easily. Certainly the rate of substantiated child abuse and neglect, unfortunately, we can get very easily. But we can't get as easily the percent of youth reporting that they feel effective as parents. And that's another one of those places where we're going to have to stretch ourselves to get the data. Lisa, you want to show the next slide, please? So for creating, to achieve thriving youth, and to build those protective factors. There's really two ways we see of doing it. One is creating opportunities for them to become involved, to succeed, to learn, and those are things that suggestions that are listed here on this slide for school-based supports and scholarships, job training, coaching and mentoring, financial literacy, affordable housing. All of those are things that will help the youth thrive, and they will help build those protective factors. But we also recognize that we need to be mindful of the risk that may be present for some of these youth. And so we need to think about what are some strategies for reducing risk at the same time that we're creating opportunities for their healthy development. So we think about all youth should have trauma screening, they should have family planning services, they should have domestic violence support, as well as opportunities for really creating constructive community engagement and constructive relationships. So, Lisa, next slide, please. And finally, to help these youth become nurturing parents. Again, it's a combination. It's not a single strategy. It's a combination of mutually reinforcing strategies. The strategies of creating opportunities that provide these youth with parent-child activities and the time and space to really engage in those activities with their children. Home visiting, bringing someone into the home to help mentor, to help teach, linking them and their children to early care and education, helping them to navigate their relationships, both with significant others and with other generations, and helping them with co-parenting supports. And even if they no longer have a relationship with the mother or father of their child, that they are still bound together to help that child grow in a healthy way. And again, it's not just creating opportunities, but it is also thinking about how do we reduce risk. And ways we reduce risk are providing those early remediation of developmental delays and also providing mental health supports when a child's behavior appears to be challenging. So this in total has been a really quick overview of the theory of change that we've developed, that we're trying to test out with this learning collective. We're interested in hearing what you all are doing, and also with the two sites that you'll hear from in a few minutes. But I'm going to stop now and see if there's any questions that any one of us on the team can answer.
So we have a question that's coming in from Charmaine McGee. I'm going to unmute you, and you'll have the microphone. Charmaine, are you able to ask a question? Hi, Charmaine. Okay, I think we just got a little too much feedback. If you want to write it into the chat box, we can say it out loud for you. And please raise your hand if you have a question at this time on the, not physically in the webinar, please. Sabine, we see that you have a question, so we are going to unmute you, Sabine. Go ahead, Sabine. You're unmuted. Bear with us as we're working out these technical difficulties. What we hoped to, or we're trying to achieve today, is really a peer-to-peer discussion, and using the webinar as a platform can be challenging, and so please continue to bear with us as we are working out these technical difficulties. We will have a couple of more question and answer sessions, and so there will be opportunities as we move through the webinar to ask questions. And so I think at this time we don't see additional hands raised or any questions in the chat box. So we will move forward with the presentation. And again, there will be opportunities later on to be able to ask the questions. All right. So now we are going to hear from both the New York City Administration for Children's Services and Sacramento County's Child Protective Services unit, and they're going to share with us how they're beginning to implement and test out the theory of change that Sarah just discussed. We are very excited about the innovative work that they're embarking on, as well as the insights to be gained from their efforts. So we're going to start with New York City's Administration for Children's Services, and I would like to introduce you to Sabine Sherry and Brock Harris, who will give you an overview of their efforts to implement the theory of change. So Sabine and Brock, you now have the microphone and you can begin.
Hello?
Yes, you are on.
Hello? Oh, okay.
You
Hi, good afternoon, everyone. This is Sabine Sherry. I'm the Assistant Commissioner with Older Youth Services and Residential Care Monitoring here at the Administration for Children's Services. And also with me is James Brock Harris, who's the Director of the Teen Specialist Unit. Our program is overseen by our Deputy Commissioner, Benita Miller, and we also are supported by Mika Nurse, who is also an Assistant Commissioner, Vicki Mitchell, who's our Program Supervisor for the Teen Specialist Unit, along with Robert Triplett, Joseph Royal, both unit supervisors, and Jamila Brown, who's been our analyst with the data. Next. So what you have before you is what we in New York City are looking at for the expected in parenting youth as data collection. As of January 2015, we have a total of 378 expected in parenting youth in our foster care system known to us. We actually have 260 female expected in parenting youth in foster care, along with 37 males that are expected in parenting youth, and 81 that are not in care but have been identified and mapped, and we'll talk about that a little later, to the expected in parenting females in foster care. Our numbers also show us that the births of the EPY females that are, there's about 223, which is 86%. 32 have 2 children. And 5 have 3 or more children that they have had. The average age of an expected in parenting female in foster care that is a parent is 18.2 years old. And the level of care, what we found in New York City, is the highest concentration of 55% of our expected in parenting youth are in our foster boarding home placements. And the next level, there's 29% of our expected in parenting females are in our residential settings, which are called maternity mother-child blended programs. 43 expected in parenting females are in what is our kinship foster homes, so that's 16% of the population. And the average length of stay that we're finding that our female expected in parenting youth are remaining in foster care are between 3 to 5 years. The total number of children born to our expected in parenting youth that we have in our system is 304. Of the 394, 213, which is 70%, still are in the care and the custody of that expected in parenting youth, and 30% are remanded into the ACS custody, where ACS has supervision of that EPY's child. And the average age of a child born to EPY that we have in care right now is 1.7 years old, and there's about 296, which is 98% of our children, of our EPY's children, that are 6 years and under, and 1% that are older than 6. Next. So what we're really trying to hope to obtain with our expectant and parenting youth as we move on and collect our data is really looking at the number of expectant and parenting youth and the characteristics that exist. Also looking at the permanent connections that are developed for our EPY, the parental engagement and the visits of the child, really looking to see how that multi-generational connection is being made, and we're doing that, and we'll explain a little bit later how we're gathering or hope to gather this information. The number of EPY that are enrolled in early care, because we're pushing the use of the educational system, the number of substantiated child abuse and neglect reports against the EPY, number of our youth that are actually, what type of school they're attending and if they're going to school and what grade level they're at. And we also are using nurse-family partnership referrals to really see at that first pregnancy before the 28 weeks that our EPY are getting the nurturing and they're getting that evidence-based model to help them along the way. We're looking at the secondary education numbers and the number of our expectant and parenting youth that are employed. And also, we're looking to roll out our co-parenting workshops, so we want to see how many of them are already enrolled so that we can get that started. Next. Next. So the thriving youth, where we have the educational success, the strong, stable connections, the physical and the mental health, and how that intertwines with the nurturing of the parent to see how we're keeping our children safe with the promotive and protective factors for the well-being, healthy, and ready to learn. I'm going to turn it over to Brock. Are you on? Okay, so there might be some difficulty in hearing. Can everyone hear me?
We can hear you clearly.
Okay. All right. So I'm going to, I don't know what's happening, so I'll just continue.
Yeah,
so
you can keep moving through. Yeah.
Okay, so we have 3 strategies that we're looking to achieve results on. And our first strategy is really developing a co-parenting policy to implement the co-parenting workshops that we're working with one of our fatherhood programs, Claremont. And part of our goal is really looking to see how we're going to engage our Young Parent Speakers Bureau. We have 2 consultants that are young parents, one in foster care and one not, that have been working really on designing a co-parenting guidebook to really speak to our young EPY that are in care. They are also working on putting together the co-parenting workshop for us. We're working with them to get ideas as we work on our policy. And part of the policy that we're providing to the contract agencies with technical assistance, we're working on an overall provider protocol for the teen specialist unit to see what other technical assistance that we can provide to them. But in July, we did distribute a memorandum of the types of technical assistance that our agency, our unit will provide in really working with the EPYs along the educational line, support for the agencies, and what other informational supports that the agency may need or that young person as we troubleshoot with our EPYs that are in our residential and in family foster care settings. Another strategy we're working on is effectively matching our EPY to foster homes. We worked with Ackerman last year, Ackerman Institute, in developing a foster parent curriculum. So we're looking to see internally within ACS, we have our parent support recruitment and really looking at how we can recruit foster parents to really understand the trauma that our EPYs go through. And also we have the Title IV e-waiver that we're looking at different models of evidence-based that we can put into these homes for our EPYs. Next. And our third strategy is really building on our capacity as a unit and making our team that the advocates and the navigators for EPY and to be there for the provider agency as we work collaboratively and just looking at the trauma-informed practices and protective and promotive factors, the framework that exists that we should be working on with our provider agency, and really coming up with an assessment tool to really assess what is happening with our young fathers and mothers as we engage them in doing this work and remain connected. So the process for the tracking the results, we're looking at our automated and manual monthly data collection that we're pulling, where we've designed an assessment tool and a survey, and that survey is what our staff is asking the expectant and parenting mothers about the fathers, so that we're gaining more data and how we're getting who those young fathers are. And we're having our weekly meetings and monthly meetings with our staff as we put this process together. Next. So with everything, there's always challenging, and one of the challenges is, of course, collecting data really on those fathers that are out of care. They may have been in care and their child may be in care, and really understanding who those dads are and working with them and reaching. So we do have a staff that is dedicated to working with our young fathers, and the work that he has done in outreach to engage some of the provider agencies in really knowing who these young men are. So we've continued to build on that in collecting that data information. There are some safety concerns because as we work with the EPY, we're very aware that there are orders of protection that are against the young men sometimes, or even against the young women that are the parents. And we just want to make sure that safety is always paramount, and we're looking at that and how we're developing for their emotional and behavioral needs, and really getting our provider agencies to understand the importance of co-parenting and the policy with the sexual reproduction that we've put out in New York City that really speaks to some of the pieces of co-parenting and fathers being engaged with their child early on. Next.
Thank you very much, Sabine, for a very thorough presentation. And next I would like to introduce Brenda Dabney from the Sacramento Children's Law Center, who is going to share Sacramento's efforts to implement aspects of the theory of change.
Hi, this is Brenda. I think Barbara Olashea has also joined us, and I wanted her to sort of start off if she's on the call. Barbara, can you begin?
Hello, can you hear me?
Yes.
Okay. Hi there, my name is Barbara Olashea. I'm with Sacramento County Child Protective Services. I'm a program planner. And Brenda Dabney, she's with Children's Law Center of Sacramento. We're both co-facilitating this implementation team for Sacramento County. And also part of the team is our youth advocate, Marie Ari. Our CPS program specialist and our data collector, Tammy Ostrowski. Tracy Lee is with County Council, and Jen McLaren as well. We also have Cindy Kane and Rachel Raymond from Children's Law Center. Next slide, please. Lisa, you can go to the next slide. What we know about our expectant parenting use in Sacramento County, we have 94 females who are currently parenting and or pregnant. The average age is 19 years old. The age range is from 15 to 21 years old. In Sacramento County, we provide extended foster care up to the age of 21. The majority of our youth live in what's called a supportive living independent plan, and those are for our 18 and older. We have 55% of them living independently. And then the next is in foster boarding home, and then a small percentage are living with relatives or in a group home. And of those pregnant and parenting youth, we have 82% living with their children. Next slide, please. What we hope to learn about our expectant parenting youth and their children is the number of males. That is something that we have been finding it to be a challenge, is making sure that we are tracking and identifying those young men, as well as the number of children with dependency cases, because the way we track it falls under, it just becomes very difficult in our system because we have our foster youth, and then when they become a parent, it changes the way it's tracked in our system under the parent. We also want to know our fathers who are involved in raising their children. There seems to be this fear of if fathers are involved, there will be a financial hit on the parent, on the fathers. And I think there's probably more that are involved, but the mothers are not reporting because there's fear of them going after further financial support. We also want to know the number of our youth who are connected with community services, as well as their children who are enrolled in early childhood education. Another challenge is identifying the positive adult connections and mentors that our youth have, as well as the presence of protective and promotive factors and parental engagements and visits with their children. Brenda?
Thank you. So as Barbara's outlined, the work being done here in Sacramento County is all geared toward creating thriving youth, obviously, who have very high levels of educational success. They have strong and stable connections, and they also have good physical and mental health. And so to be able to instill those things in both the mothers and the fathers that we hope to identify as part of this project, to really create circumstances in which those youth are thriving and can be proud parents and want to parent appropriately for their young children. Because as we all know, having teenagers with high levels of self-esteem and with confidence and creating a sense of optimism in their lives, which many of our youth in foster care don't necessarily get from the backgrounds that they experience, really can make the difference in how they become parents themselves. And so we want them to be nurturing parents that are able to raise children who are safe, who are healthy, they're getting immunizations, they're taking them to regular baby checkup exams, and that they're ready to enter early childhood education and other educational programs. Next slide. So in Sacramento, we've identified a number of strategies that we hope are going to bring us to just those goals. The first one is we have decided that what we wanted to do as a primary point here in this grant work is to redesign our whole family foster home curriculum. Our whole family foster home concept was codified several years ago in California legislation, which was envisioned to be a residential family type setting where these teens could either move to live with their babies or continue to live after the birth of their child, where they have strong, stable connections already in theory, and those foster parents would be empowered to raise the teen in a way to assist them with modeling good parenting strategies and to help them to learn how to become resilient parents themselves. And so several years ago there became a number of, there's a certification process throughout California that is implemented locally. Here in Sacramento County it's implemented by local groups, and the curriculum itself we've uncovered in the last year or so from talking with some of the youth and the foster parents who had been certified, that it really wasn't addressing the needs or meeting the goals of being that safe and stable home to help the youth learn to thrive and become a good parent. It sort of had, I think, what we call suffered from a little bit of mission creep, in that the certification, the curriculum, had really started to become overwhelmingly focused on raising infants. And so these foster parents were being shown strategies to address infant care and infant needs and developmental issues with infants, and little attention was going to actually addressing the needs of the developing teenager. And so one of the things that we know that we needed to change was to gear the curriculum in more of a way that addressed a developing teenager with all of that teen's needs and wants and desires, developmentally, emotionally, hormonally, if it's the mother, obviously, during pregnancy, and really work with them to raise them in a way that they want to be good parents and to have them in a safe environment of the certified home where they could try new and different things and do things differently than what they had experienced themselves as young children, and used their safe environment to really be able to help them engage in some low-level trial and risk kinds of things and learn good parenting experiences and to sort of replicate those, and to not engage so much in some of the more negative kinds of parenting that they may have learned as a young child themselves. So one of the first things that we've done to attack this redesign, for lack of a better word, is to survey a lot of the expectant and parenting teens who had gone through one of these homes in their foster care experience, and also to survey some of the actual foster homes. And so we're in the middle now of getting those surveys done, and we're moving along trying to get the data back, and ultimately we'll be analyzing that and making some selections of places in the current curriculum that need changing or that need some augmentation in certain areas. We also are looking at other jurisdictions and trying to pull the best of what we see out there, including from our partners in New York City and from some folks doing some good work in Los Angeles County as well on the West Coast, to try to really pull a lot of the good work that's based on proven research out there of what would make a good curriculum. And then also all of this would be geared toward designing a curriculum that includes the multi-generational needs of our expectant and parenting youth and their own children at their actual developmental level. Okay, next slide. Thanks. So our second strategy, one of the other prongs that we thought was essential, especially in Sacramento County, we are really lucky in that there's a lot of community involvement in lots of different areas when it comes to child welfare practice. And so we've noticed that there are a number of mentoring groups, very small mentoring groups throughout the county that are not really connected at all, and that are doing great things individually in different places. And so we thought this project would really benefit from creating a mentoring community, joining a number of these groups that are addressing especially the pregnant parenting teens and father initiatives to just shore up the self-esteem of teens, to help teach them parenting skills, or to just create peer-to-peer opportunities for them to learn safe and proven baby care and infant care techniques, and to strengthen what some of the good things they've already learned about parenting, and to dispel some of the myths. So we've accumulated information and some partners from a lot of local groups who are agreeing to join us in sharing resources and outreaching to different segments of the community in Sacramento, and really pulling in the best of the best so that we can get through to the fathers we know exist that unfortunately our data in Sacramento County doesn't identify appropriately, and to really reach out to them in a way that encourages them to become part of their babies' lives instead of trying to remain invisible, so that county systems who might be searching for them for other reasons don't derail their parenting efforts. And so that's been one of our biggest, most exciting pieces of this, is really the mentoring part of this grant. Next slide. Barbara, I think I'll let you take this one, since you can talk a little bit about Marie's involvement in our project.
Hello, can you hear me?
Yes.
So strategy number 3 is incorporating youth voice in all policy and program development. We're really lucky and excited to have Marie on board as our youth advocate. She is an AmeriCorps member who has started working with us in October. And the Children's Law Center has also hired 2 peer advocates who are devoted part-time to work on this initiative. Marie has already started doing implementing the whole family foster home survey to foster youth. She's been reaching out to them even before she's implemented the survey to connect with them to see if there's anything that she can do of support and make referrals and such. Marie has also been there for our social workers. We've made it known that she is there, and social workers will connect with her if they have a new pregnant or parenting youth on their caseload, and she will assist them as they need. What we want to do is also have our youth advocates involved also, though, in when we start developing new policies and programs, and that is something that we're starting to do. And we were really excited when we went out to New York in January and how they've hired youth consultants, and we thought that was something that Sacramento County should really look into doing. And so for this past month, we're looking at hiring additional youth consultants who are either current or former EPI youth. Something that we are lacking is having that the father voice. And so we would like to bring a father on board as well. And we want them to be there to assist us in this whole family foster home redesign, mentoring training. We want to also do a reproductive health policy. And so we want them to participate in that development, planning, training, and outreach to staff and to our community providers. Process for tracking our results. We have automated and manual data collection. We do have a database that we are able to track some of this information, but in reality, a lot of it is going to be hand counts. We have to do a qualitative type of data collection so that we're doing surveys, and in the future we'll be doing focus groups as well. And right now we're meeting twice a month, about every other week, to ensure that we're reaching our targets. Challenges that we are facing is data collection, but also I think it's ensuring that we're collecting the right data. And as we are moving along implementing our surveys, we want to look and make sure, are we getting the information that we want from those surveys? And that was something actually just before this webinar started. Marie and I were just talking about some of the information that's coming through, and so we need to look to see if this is the survey is really answering the questions that we want. Locating a whole family foster home curriculum from other jurisdictions to review. That's a challenge. We need to make sure that's going to be a good fit for our community and for our needs. Finding whole family foster homes willing to participate in the new curriculum training. Outreach, I heard New York mention that. It's going to be really imperative that we really target not only just the training but the outreach and ensuring we get foster parents who are interested and wanting to take on that kind of fostering role. Tracking quality of permanent connections with whole family foster homes and mentors, or it's really with our, yeah, that is true. We have foster youth who, it's a challenge. They move, our foster youth move frequently, and really recognizing what kind of connections have they made with their foster parents and or mentors in their life. That's something we just don't track in our database, and that's something that we would have to get through our surveys.
Thank you, Sabine, Brock, Brenda, and Barbara, for a very informative presentation, particularly the areas where each of you are tackling policy, practice, and training issues, and can really provide a more in-depth understanding of what are the system changes necessary to create opportunities and reduce risk for expectant and parenting youth and their children. At this time, we would like to open it up for a question and answer to each of our grantees. We already have a couple of folks that have raised their hands. The first is Tammy Fleming, and so we are going to unmute you at this point so that you can ask your question. And I would like to introduce Tammy. Tammy is our grants officer from the Annie E. Casey Foundation, who is supporting us in being able to carry out these efforts with New York City and Sacramento. Tammy, are you able to see if you can speak? We have unmuted you.
Okay, can you hear me?
Yes, clearly.
Perfect. I thought the question I asked New York was, what was the total amount of children in their system? They presented a nice table at the beginning of their presentation about the number of pregnant, expectant, and parenting youth, but there was no overall number. How many young people are actually within their jurisdiction?
Okay, Sabine, we're going to unmute you so that you have an opportunity to respond.
We have about 18,000 children in foster care system in New York City.
Okay, thank you. Thank you.
Welcome. You're welcome.
Okay. All right. The next person is Arthur Aragomanes. So we will unmute you at this point.
Yes, hi. So I was just interested in what type of emotional health and emotional intelligence work is incorporated into the strategies in both programs, along with the mental and physical health.
Okay, so we will unmute both Brock, Sabine, Brenda, and Barbara, so you guys can have a chance to respond.
This is Brenda from Sacramento. I'll just say, in terms of the emotional health piece, obviously we recognize that's very vital to this population of teenagers, both young men and young women. And so our hope is through the a combination of the mentoring connections that we're able to make through the grant and the overall change in practice that we hope to see as a result of identifying more of the youth and really meeting their needs in their home environment a little bit better, that we'll be able to shore up their emotional needs in that way, be that through, as I think I mentioned, parenting role modeling with caregivers, through mentoring relationships with folks in the community, or through referrals to outside agencies for things like group counseling or mommy and me groups or things along those lines. Barbara, you want to talk a little bit more about Sacramento County?
I do. I also wanted to add that there's a new practice and a law that came through in regards to KDA. It was a lawsuit that happened in the state of California. And for any children who are in out-of-home care, require a mental health assessment on a yearly basis. So for any of our foster youth who are currently not accessing mental health services, our social workers are required to reassess at minimum on a yearly basis, if not more, if it's deemed needed for services.
In New York, what our team is doing, the teen specialist unit around emotional health, is a lot of our teen specialists are running what's called wellness groups with the provider agencies, where they're looking at self-esteem work that they're doing with the young ladies, whether it be fashion shows, hygiene issues. So we're really looking at how we're empowering their well-being as young ladies, since most of our population are the young ladies that are known to us that are expectant and parenting youth, and really doing the referrals properly for the mental health issues that may exist, if there's psychotropic medication. So really engaging them and also empowering them to understand what's happening with them.
This is Sarah Morrison. Yeah, thank you. This is Sarah Morrison again from CSSP, and I think it's a great question about emotional health, and it's also one of those things that the slide around the protective and promotive factors that we went over a little while ago. What we're working with both sites and where we've worked around the country is that it's an approach that we ask that we help embed in practice. So to help a youth think about their own resilience or to learn about their own knowledge or gain their own knowledge of development is really a relational thing. And so I think someone, I think either Brenda or Barbara a moment ago talked about building it into practice, that it's not necessarily a single program or a single strategy, but it's really respecting the youth and empowering them and helping them by building relationships. And when we visit with them, when we seek to match mentors, it's really with that emotional health in mind. So I think it's a good question, but I don't know that there's any single program that anyone is looking at in the 2 sites that we're working with, that we're looking at multiple ways of building that emotional health. But thanks for asking.
Yeah, I mean, I also think that key to core to the protective factors that we know are associated with healthy adolescent development and also with healthy young children is that their social, emotional, and behavioral and cognitive competencies are improved. So I think a lot of the work that has to be done, whether it's through the foster parents themselves, whether it's through the agencies, the workers, nurse family partner, whoever is coming into contact with those families, is how are you building those core sort of capacities and characteristics within the parent as an adolescent and also as a parent that is building, that's enabling them to achieve the type of outcomes that they need. So whether it's, you know, emotional regulation or executive functioning or emotional control, whatever it is, self-identity, that's all part of a sort of a more holistic approach that needs to look at all dimensions of well-being and competencies that we want to develop in these young families.
Thank you. And that was Susan Nakin, who is the Associate Director at the Center for the Study of Social Policy. We are still waiting for some more questions, but in the meantime, we have a couple of questions. For the first one is for Sacramento County. In our recent newsletter, you talked about a young mom who had 2 children, and you shared with us her experience of having her children removed and then the process that she went through to be reunified with her children. Thinking about the theory of change, what more could have been done, or what could have been done differently in working with that young mom?
Yeah, Lisa, I think I know the case you're talking about. I think our entire idea about in terms of the theory of change is to look at these cases case by case. And for instance, in that instance, instead of removing a young child from a mother, it may have been better for the family in the long term and the short term to really have the agency assess the family unit as to the specific risks that might have been identified, and then put in place some kind of safety measures that would prevent harm to children in the home as it was, as opposed to removing the children right away from the harm. For instance, we see a lot of drug cases in Sacramento County where there could be relatives either nearby or in the home or next door or in the neighborhood that children can be left with while the parent is able to really focus on drug rehabilitation and all of the impacts of their drug use. But they still would be allowed frequent, supervised, quality visits with their young children. So that will continue to inspire the children to be excited about when mommy is around or when daddy is around, and all the while making sure that they're kept from the harm that the parent may have engaged in. It allows the parent to focus on their own issues independently without the stressors of having to raise young children simultaneously. And then it also allows the family unit to feel supported during this temporary separation and to continue some of their basic family rituals like dinner time, sharing dinner time, or reading before bedtime, or really giving the children the enjoyment of spending some time with this extended family member. Frequently, very young children don't really understand why they're not sleeping in their own bed anymore, for instance, or what have you. And so the excitement of a sleepover at grandma's house sometimes is enough to sort of alleviate any stress, any trauma to them, while at the same time allowing the parent to focus on their problems. Overall, the theory of change we would like to see is to create a system where we make parents really filled with hope and not have them penalized for one or a couple of series of poor choices, and to change practice to focus on what the family needs instead of focusing on what they deserve.
Thank you very much for that very thorough response. And one other question for New York City. What are some initial takeaways from your efforts to identify and engage fathers in their role as parents?
Hello?
Yes,
Yeah,
we can hear you.
Okay, I'm sorry. What was the question again?
What are some initial takeaways from your efforts to identify and engage fathers in their role as parents?
I think one of the takeaways is that since getting involved with the fathers, meeting the young fathers, that they just want to be given a voice. That's one of the takeaways that we had, because we just had our young fathers convening about 2 weeks ago, and it was just overwhelming to just hear the feedback from the young men on how they do want to be a part of their children's life and being given that opportunity. So the process of the mapping that we've developed in identifying who the young fathers are to the children at times can be difficult, because the young ladies are fearful that they'll get the young man in trouble if there's anything that's happening, if he's older than them. Are we going to report something regarding this young man's lifestyle? So they become resistant to really talking with us and opening up. But one of the good things is that our team really continues to engage the young ladies to really make them feel comfortable in order for them to really open up and disclose without feeling that they have to get that young man in trouble. And we're putting disclaimers as we're using our assessment tool when we're speaking with them to let them know that this is confidential, but we just want to make sure that you're safe, but we also want to know, we're just trying to get information on who the dads are.
Thank you very much. Okay, so now we want to move into our discussion on the Preventing Sex Trafficking and Strengthening Families Act, which was signed into law in September of 2014, which established the prudent and parenting standard that really intends to promote normalcy for all youth in foster care. And it's a standard that all states must meet. Our goal for this next session is to really have a rich discussion and share and learn from one another's thinking on how to best apply the standard to expectant and parenting youth and their children. And so I just want to read from the Act just to kind of jumpstart our thinking and make sure that we're all on the same page in terms of what the Act is about. So the term reasonable and prudent parent standard means the standard characterized by careful and sensible parental decisions that maintain the health, safety, and best interests of a child, while at the same time encouraging the emotional and developmental growth of the child, that a caregiver shall use when determining whether to allow a child in foster care under the responsibility of the state to participate in extracurricular, enrichment, cultural, and social activities. CSSP has published a set of guidelines for states implementing the Act. You can find this on our website, and we wanted to highlight 3 recommendations from that document that are specific to expectant and parenting youth. Again, that we can use this information as we discuss what are the best ways to apply the standard. And so the 3 recommendations are to support the developmental and emotional needs of youth both as adolescents and as parents by creating opportunities for them to experience socially and developmentally appropriate activities such as after-school activities, playing in sports, overnight stays, school field trips, and really supporting them in being able to balance being an adolescent and attending those activities with their parenting responsibilities. The second recommendation is to specify the inclusion and support of young fathers. Fathers, we've heard from the grantees, and we know this from all the research, they need to be engaged and supported in their parenting roles. And we're also heard a lot from New York City about their efforts to really promote healthy co-parenting between the fathers and the mothers. And we hope to learn more on how that could be a pathway to improving well-being for the child. The third recommendation is providing training and education around supporting the healthy development and well-being of expectant and parenting youth in care. And really, caregivers need the training to better be able to support expectant and parenting youth and their foster care, and expectant and parenting youth in foster care and their children. We heard from Sacramento County and they're thinking around how to better improve their whole family foster care training curriculum and making sure that that curriculum is both trauma and developmentally informed. So these are the 3 recommendations that we want you to keep in mind as we have a discussion around these questions. And we can start with the first one and then move forward. And so the first question that we want to talk about is, how is normalcy for expectant and parenting youth currently supported in your child welfare system or agency? So again, feel free to either type in your comment into the chat box or raise your hand and we will unmute you. And also, it might be easier because I'm keeping in mind how much time we have left. If anybody wants to comment or discuss any of the questions, you can feel free to do so.
This is Susan Notkin, and I just, one of the things that we hear quite a bit from the work that we've been doing with our colleagues from Rise Magazine, which is a magazine written by parents involved in the child welfare system, and they have taken a particular are paying a lot of attention to the needs of expectant and parenting youth in foster care, is, how their concerns about how many young people are ending up getting reported for allegations of abuse and neglect, often for sort of doing behaviors that if they were not in foster care, would probably never rise to the occasion of becoming a report and an allegation. So it's the sort of like, how do you empower this sort of third question? How do you make sure that caregivers are empowered to be able to exercise this prudent parenting standard, to know that they don't have to make, that there are ways of resolving and dealing with risk-taking behavior, especially when it's low-risk taking behavior, low risk, that doesn't necessitate the actual report of, it doesn't rise to the point of needing to be a report to Child Protection Services. Again, we're not talking about situations where child safety is in doubt, but where there really were cases where foster parents and residential providers need to feel like they can exercise some of those decision-making and not have to worry about, being held, not having to worry about reporting everything.
Thank you. And then we have a question from Latasha Burke, and so we will unmute you so that you can, or your comment, so you can say this. Latasha Burke, excuse me.
Hi, how you doing? Hello?
Yes, we can hear you.
Oh, okay, yes. I just wanted to say that the New Jersey Division of Children and Families, as a worker, they really did support the expectant and parenting youth in the areas of normalcy by providing payment through different funding sources at the local office for engagement and outings with friends, ensuring that they were appropriately attired as a expectant and a parenting youth and able to provide extracurricular activities for their children in the community. So I do believe that we're on the right track with support supporting our parents and the expected parents.
Thank you very much for sharing that. Are there any other questions or comments? So I think this is a great start to an ongoing conversation that we hope to continue to have and exchange ideas and learn from through this collective as the states move towards implementing this act. We want to share with you our vision for the collective. It's to really have a national and interactive forum where professionals can exchange ideas, information, and resources on innovative approaches and policies to improving well-being outcomes for expectant and parenting youth in foster care and their children. Some of the benefits of joining our collective really is connecting with other professionals, working on tools, resources, webinars, as well as receiving technical assistance via awareness about the unique needs of these young families, as well as having innovative work highlighted in national forum. Our platform is a web page on the CSSP website, which is really a hub for information and makes it easy to access all kinds of resources and tools and share those resources and tools with peers nationally. In addition to a private Facebook group, which is accessed by members only, where peers can initiate discussions and ask questions and exchange ideas. So right now, hopefully you all can see our website, the Center for the Study of Social Policy website, and we would like to give you a virtual tour form tab and selecting Expectant and Parenting Youth in Foster Care. Our landing page has 3 sections. The About Us section, which it also has an archive of our newsletter. Section is Meet the Grantees. Third section includes tools, research, and resources. And it is divided into, I want to highlight some documents in each section. So in the policy, under the policy resources, I would like to highlight the guidance for states implementing the acts that we just discussed, as well as another guidance, practice resource, a resource guide that we issued on evidence-based and evidence-informed programs or practices that are targeted towards achieving well-being outcomes for expectant and parentive and protective factors framework. Those that are specific to strengthening families, that are focused on parenting and focused on the early childhood development, as well as the Youth Thrive, which are focused on healthy adolescent development. And in the last section, which is the research and data section, I would like to highlight the California report, where they were able to match birth records of expectant and parenting youth in foster care with child welfare data reports. Washington State data report comparing youth in foster care to other teen young mothers who are not in foster care. So this just gives you a quick overview and tour of our website and the information that we have thus far. We will continually be updating the information that's on the website, particularly the tools, resources, and research piece, and we encourage you to email us. If you come across any new resource, please email it to us. We're going to share the email in a second so that we can upload it and share it with the field at large. At this point, we have couple of minutes left. It's really important for us to hear your feedback on the network, on the newsletter, as well as the website, so that we can really improve and make sure that this meets, supports you in meeting the needs of expectant and parenting youth in foster care within your jurisdiction. And so we're going to open it up to see if you have any feedback, if there's additional information that you would want access to, or if there are any topics for the webinar that you would like to see covered in the future. Okay, feel free to connect with us on Facebook and or send us information at any point in time for any suggestions or any resources or tools that you come across. Our email is epyinfo@cssp.org. We look forward to connecting, sharing, and learning with you in the future. Thank you to all of the presenters. Thank you to the Annie Casey Foundation, as well as the CSSP team, particularly Teresa Becky, for helping put this webinar together. Have a great afternoon, everyone. Thank you.